The real flu is a bad illness. Flu can spread very quickly in the world. We're all a plane flight away from every infection out there.
Influenza. The seasonal flu kills an average of 36,000 people in the United States every year, and it sends 200,000 to the hospital.
People talk about the stomach flu and other flus, but influenza that happens every year in the wintertime is actually a contagious respiratory illness.
Influenza, if you get it, you will remember it. You will have fevers to 103, you will feel like you've been pummeled with a hammer, and you will try and cough your spleen up.
That kind of misery is something that many people can easily avoid.
And there's really 3 reasons that we get to live to our 80s. Flush toilets, good nutrition, and vaccines.
Getting vaccinated is the very best way for people to protect themselves and their loved ones against influenza. You cannot get influenza from the influenza vaccine, either the shot or the nasal vaccine. It can't happen. In addition to getting vaccinated, there are some other things, kind of common sense things that people can do to protect themselves against influenza. So that would include covering your cough, washing your hands, and staying home when you're sick, not going out when you have a fever or when you might spread disease to others.
The flu virus is one of the only diseases doctors vaccinate for that changes every year. It mutates on a regular basis.
During a season, all the flu viruses have the chance to be different at the end of it than they were at the beginning. It's a very tricky virus, and so you just have to be constantly watchful.
Even though this year's flu season is well underway, researchers here at the Centers for Disease Control in Atlanta are working with researchers overseas to figure out what they can do to protect us from next year's flu virus.
You have to do a lot of monitoring around the globe in order to get a good sense of what strains are out there. There's a global collaboration between different countries and different public health agencies about strains that are circulating thousands of miles away but could come very easily to our part of the world. So there's a lot of benefits as well as the challenge of easier transmission of disease in a global world.
That easy transmission is particularly worrisome to health experts. World travel, thanks to airplanes and ships, and even world trade, means different strains of the seasonal flu travel more quickly and widely than ever before. That has more alarming consequences if there's a more serious outbreak.
When you get a virus, a flu virus, that no one has been exposed to it, then their bodies are not used to the infection, and their ability to fight that infection is very low, and it's a very much more serious situation, and we call that situation a pandemic. And in the last century, there have been 3 pandemics.
In the 1918-1919 pandemic, the one that killed 80 million people or so, it was a bird flu, and it managed to jump into human beings.
We feel pretty confident that a pandemic will happen again. It's just very difficult to know when.
Fortunately, the current strain, as I understand it, a bird flu that's sweeping the world and killing chickens, only can infect you if it gets into receptors that are very deep in your lung. So you really have to suck in a lot of bird flu to get affected. But it's evolving slowly towards, looks like, more infectivity towards humans. If that happens, they estimate it could kill 2% of the world.
Researchers say even though they're not sure when a pandemic could hit, they are doing what they can to be prepared to handle it medically when it does. But the government also has to figure out how to keep the nation and the world running in the event of a pandemic.
There's a lot to plan out with regards to how we would keep all of our essential functions going. And I know the federal government is working hard on that, and state and local governments are, but every individual family and business is also going to have a role in what they're going to do during a pandemic.
Santoli says all in all, the flu is nothing to sneeze at.
Seasonal influenza, I think that most people actually don't realize how serious it is or how many people are hospitalized or die each year. So I think it is really important for people to understand that and the steps that they can take to protect themselves. For the pandemic situation that we're thinking about, I think the most important thing is that planning and preparing for that kind of a situation can also mean that it would be a less devastating situation when we face it.